So I'm showing you the knee procedure now. So we're finding the top outside corner of the patella, 4 corners there, that's the outside part. And this part of my thumb I'm putting just over the outside edge at this angle, and then I'm joining the other thumb up to it so they're butted together. So my skin slack is going to go down towards the ground, and then this is a slow move, so this will take about 6 seconds. So I'm slowly moving up and up and up and up and up and over to the top, and there should be a little pop when you get over to the top. And the next move on the knee procedure then is you find the bottom 2 corners of this patella, squeeze together, and on the inside you do a move upwards, and followed by on the outside with your thumb you do a move upwards. So I'm going around the corners of the patella. I'm having a 2-minute break there, where I would do the other knee in the 2-minute break. Do exactly the same. And after the 2-minute break, I'd find the inside corner of the patella and I'd measure 3 fingers up and 3 fingers out from the midline. And then that's the point where I'll find the outside edge of the muscle, and I'm going to put the skin slack down towards the ground, press in, and then do the move upwards. Okay. And then I'm going to lift the knee up, sit on just on the toes to keep them solid, and with my hands up there where my middle fingers are, I'm going to find the center of the gastrocnemi, and I'm going to do a move first of all on the outer side. So I'm pressing in to start with, and then I'm doing a move out like that, and then I'm doing the same on the inside aspect of that muscle. I'm taking the skin slack this time towards the outside, digging in with my fingers, and then rolling around the muscle on the inside of the gastrocnemi. And then I'm going to tease down, opening up the muscle all the way down. Sometimes this can be really painful on people if they've got a lot of trauma in that muscle and a lot of knots. So the first time you can do it fairly gently all the way down to the bottom of the gastrocnemi, and you can repeat that and go a little bit deeper to get more movement in. And then where it turns into Achilles tendon, do 3 moves about an inch apart, and the medial moves so the slack goes to the outside, and I'm just going over the tendon, dropping down, going over the tendon, dropping down, going over the tendon. 3 medial moves. After a 2-minute break then, we can just squeeze the calf muscles back together, because it's like you've opened them up before to get some flow going down, and then you can squeeze them back together. And then to finish, we have a little move on the inside of the ankle. Right, so we're looking for the inside malleolus, which is a little bone, and the move is going to be like that. So it's a little move upwards at an angle. So it's between the ankle bone and the Achilles tendon. Halfway between there's a little bundle of nerves, and you just move the bundle upwards a little bit. And then pop the leg down, and then work on the other leg.